In this module, we'll discuss the cardiovascular causes of Alzheimer's and how to address them. As we all know, the brain is estimated to use about 20% of the entire body's energy, and so blood vessels become very important because they transport the nutrients and oxygen that are critical for producing energy and supporting all cellular processes. They also help remove waste products that are created as a result of everyday normal cellular activities. So it's kind of like your Uber Eats and garbage pickup services all in one. So important, right? As a result, anything that causes problems for blood vessels, especially blood vessels that go into the brain, will cause problems for the brain. And a brain that doesn't receive nutrients can't produce energy for brain activities. And if waste products aren't removed, cells can get toxic and die. So, how do we know whether there are problems with the blood vessels in your brain? Well, apart from a brain scan like an MRI or any of the ones we've already discussed, you can also infer that from whether you've had any cardiovascular issues outside of the brain. The reason is that blood vessels go everywhere in your body. If there's a problem with the blood vessels that go to your heart or to your legs and even to your genitals, chances are that the same issues are happening to the ones that go to your brain. They're just not as severe enough to show up in a big way yet. And what are the problems that are telltale signs? High blood pressure or hypertension is an early stage symptom that causes a lot of problems for small blood vessels. That's because some of the small blood vessels that supply parts of your brain and other peripheral areas can be so small that their cells are only 1 cell thick. So when you have high blood pressure, the force that the blood is being pumped through with can cause the blood vessels to burst. And that's when you get microbleeds in the brain. And you'll be able to see these patterns in the imaging studies. Now, I know this sounds terrible, but it may not show very obvious symptoms because these are microbleeds. If you have a number of these microbleeds, it basically means that over time, the affected parts of your brain aren't getting enough nutrients and the waste products start to accumulate. So now you start to get dysfunction and impaired cognition can start to happen if this happens in the forebrain, which is responsible for executive function. Other more obvious telltale signs include conditions like peripheral arterial and venous diseases and erectile dysfunction, which is a sign that blood flow to the male reproductive system is compromised. And of course, the really serious events like a heart attack or stroke, which is an occlusion of a major artery that supplies the brain.
This was an excerpt from our Masterclass Ending Alzheimer's with the Bredesen protocol. If you liked this video and found it helpful, you'll want to check out this masterclass at our Sophus online website. Click below to find out more.